Hi everyone, my name is Kelly Swanson, and the special population that I am working with is social work with children and adolescents with medical conditions. So working with children and adolescents. Children and adolescents could be coming to a hospital for many different reasons. They could have a health problem that only lasts a few days, um, such as the flu, an injury, um, or some other sort of illness or injury that they may experience, and they may be in the hospital for a couple hours, maybe a day, and then they move on to another doctor's appointment from there after they receive medication that they need and the proper treatment. Other health problems are more serious, and that could require frequent hospitalizations and monitoring, and this could be illnesses such as cancer or diabetes, or asthma is also a big um, illness in the children and adolescent community. Illnesses in children could occur unexpectedly, or children may have been feeling some symptoms or may have had some problems in a few weeks or a few months, and it's caused a disruption to their daily life with their family and school. So this may cause them to have to go into the hospital. Challenges for this population. With children, they are most likely in school, and they have friends and family outside of the hospital that were there before the illness. So trying to keep the child active with school friends and family can be a challenge. One of a social worker's jobs could be to help arranging children to continue their education while they are in the hospital, and they can also help with continuing the child's connections with their family and friends after their diagnosis. And this could be as simple as letting them use the phone or an iPad for a couple hours a day, and for school, if they have a laptop or the hospital has a laptop available, they may be able to use this to help the child complete their education. In this population, fear is magnified and can cause trauma. Children may have feelings of helplessness and vulnerability, discomfort and pain, confusion, and not only do the children experience some trauma, the parents can also feel some distress, and also siblings can also feel the distress. And there also are feelings of uncertainty. Addressing the challenges and needs of this population. So one thing that social workers can do is they can play games and use drawings to help the child open up about their fears and anxieties. This is not only proving to work with children in the hospital setting, this works in typical therapy sessions as well. So I think it could be a good way for the child to explain to somebody what they are feeling, what they're nervous about, and even what their pain feels like to them. A social worker can also empathize with the child and focus on their achievements and what they can achieve. So a lot of the nurses and doctors are going to be saying things that the child most likely doesn't understand and could make them scared. So every time the child hits a milestone while they're in the hospital, the social worker can really focus on the achievements, and they can also focus on what the next achievement is and what they can also achieve through more of their treatment. Information and communication technology, or ICTs, can be helpful as well. So as said before, children are in a stage where they're still socializing with friends from school and in the neighborhood, and they have family members who may not be able to see them. So ICT is a suitable and timely solution to offer these children means to socialize and remain safe. So in what ways would a social worker be able to coordinate a peer-to-peer interaction with a child in the hospital long term? So a social worker could facilitate some group meetups with those youth who are able to, depending on what their illness is. They could also perform traditional support group meetings. There may be children with the same type of illness they could have a support group for, or they may have a support group for children who are having trouble with not being able to be in school and be with their friends. So support groups would be a really big help, and it would help the child interact more with peers their age. A social worker could also organize some events. They could have birthday parties, Christmas parties. They could do movie nights or days. They could do painting nights or days, and some other fun activities. along those lines. Resources needed for the social worker. So my question here would be, how would a social worker help a child patient, overcome the lack of peer socialization? So for the younger age group, maybe for ages 2 to 7 or 8, we could use dolls, puppets, or other toys in play therapy if that is an option for the child. So this would probably be more appropriate for a younger child. We could also use drawings or coloring to see if we could help the child open up. If the child is in school and has friends outside of the hospital and family members, and they they are not able to communicate with them in person, we could make sure there are computers, tablets, and phones or other communication devices. So the child could possibly get some schoolwork done, FaceTime with friends, even maybe do a video of the class that they are taking, and also to talk with their family. It could be really helpful. So social workers will want to research programs outside of the hospital setting for the patients when they leave, and for their parents and even their siblings, because they are affected as well. So social worker could find maybe some family therapy programs so the family can continue to learn how to work together through the illness, and how to continue to communicate as a family unit. They may also need to help find other doctors outside of the hospital, camps for the siblings and for the child who may have an illness, or even just some, different organizations for the parents to join so they feel a sense of community with the illness that their child is going through. Some other examples of what a social worker could do is they could provide counseling to the family while they are still in the hospital, going through the treatments. They could help a child learn some social skills training, so before they leave, if they're apprehensive about socializing with their peers again and getting back into that normal routine, we could help them learn some social skills. And we could also help them develop some coping skills. So while they're in the hospital, they're probably scared, they're probably sad, anxious. So we could come up with some ideas to help them cope while they're in the hospital, and come up with some activities they could do that would help them calm down. Resources needed for clients. So social workers could provide literature on the child's diagnosis to the child and the family. So when the child and their family are getting the diagnosis, there may be some big medical terms that are being thrown around. So as a social worker, we should be educated on those medical terms, but we should also be able to explain the diagnosis to the children and the family in a comforting and understanding way, and providing some literature to the family on their diagnosis would be helpful as well. A child life specialist could be helpful when preparing a child for a procedure, so they could help the child go through, what the whole procedure will be like step by step, and they can explain it in a way that they would understand, and explain what could happen before and after, and they could even possibly be with them before the procedure happens. As said before, play and expressive therapy can be used to assist hospitalized children. So this could be, again, with dolls, with other toys, this could be with coloring, anything that we think that will help the child open up a little bit more about their pain and their feelings of anxiety. And we can also help with anxiety management techniques. We could figure out how, what is causing their anxiety and what could possibly calm them down. If it's, color by number, if it's playing a game, if it's reading a book, listening to music, we can help them learn some techniques to help them manage their anxiety when they're nervous about a procedure, or when they're nervous about their diagnosis. So distinguishing yourself as a social worker in this population. So the social worker needs to advocate for the client and their family. They will want to be able to express to the medical team what the family and the child want and what they think it would be best for the child, even if that possibly means going against what the medical team wants to do. The social worker should also be comfort for the client and their family. The medical team will throw out the diagnosis and throw out all the medical terms, but the social worker can be there to sit with the family and process their feelings with them. And the social worker, along those lines as well, will build a relationship with the patient and their family so they can feel comfortable with this social worker opening up, and so the social worker can help them find resources that they need. The social worker will not only be a resource for the patient, but they will be a useful resource to the family of the patient as well. So while the social worker's main focus is on the patient, their focus is also on the family who is going through this, which means siblings, parents, or guardians. So they will also need to be able to communicate with them and help them open up about what their feelings are and see if they can provide them some extra help as their child goes through the procedure and the diagnosis. And the social worker could also be a resource to the child's friends as they will notice that that this patient is gone. So if a child has to be removed from the school setting, I'm sure that their classmates will notice. So something that they could do is possibly have the social worker come in and talk about the patient, or if they have close friends, the social worker could possibly provide a meetup with the child in the hospital and maybe talk to the child's friend and kind of explain everything that's going on, and see if they can help the child's friend be a resource to them while they are going through the diagnosis, and at the same time help comfort that friend, so they know what is going on and they know that their friend will be okay. That is my presentation. Thank you.